It's being reported that right now scientists believe the new coronavirus variant identified in this country is more transmissible than earlier variants. But a scientist on the panel advising government has told Bloomberg that there's no evidence to suggest that it is indeed more severe. The new variant has all provinces fretting while the country awaits the rollout of a vaccine. South Africa has announced that the first 1.5 million doses of coronavirus vaccines will arrive this month and next month to protect frontline workers. And while there is a public-private partnership involved now in procurement, it's not yet clear how the majority of South Africans will be immunized. Let's talk about some of the potential risks and where we are right now. To discuss, we're joined by public health medicine specialist at UCT, Dr. Kerrin Begg. Doctor, thank you for being with us. Firstly, your comment on recent reports that the new variant does indeed spread more easily, but it's not necessarily worse than what we saw in the first wave.
Correct. That does appear to be the evidence. What we've seen and what the scientists have reported in terms of the genomic sequencing of this new variant is that it certainly has some mutations to the spike proteins. And what that means is that it appears to be more transmissible in the way that it connects into the cells and may also be a little more resistant to antibodies, is what the suspicion is. We're still watching the clinical impact of the new variant to really fully understand what the impacts will be.
Just anecdotally, some doctors I've spoken to say they are seeing a real difference in sort of the intensity of sicknesses in young people, for example. So is it too early to say, or could that be maybe because now we know a lot of the super spreader events involved young people, maybe just more young people are getting sick?
So I think that one of the things that we need to understand is that it's also about numbers. So remember that we're sitting now with up to 20,000 cases a day. In the first wave, our peak was at around 12,500. So if you think that we're almost double the number of cases that we had at the peak of the first wave, then we are seeing more cases. And the relative proportion of those cases that are severe is then is the same, but the absolute number is much greater. Yeah. So we will always be seeing more cases and more severe cases, just simply because we've just got many more cases that we're seeing. I think the young adults that we are seeing is in part probably linked to the fact that they have been more exposed. Certainly throughout the first wave, remember that we were still under quite hard lockdown. Young people were not really getting out because schools still had very limited, children and teens had very limited access to schools, and universities, which only really got going in the second and last quarter of the year. And really around towards the end of the year, those super spreader events had a significant impact on young people, where the super spreader, the susceptible population, was so much greater and really contained young people. Yeah. So, young people are not immune, and we never said they were immune. Sometimes they just feel that they're immune.
All right. A big question, concern, I guess, has been, will this new variant be resistant to the vaccines that have been developed around the previous variants? Does it seem like we'll be covered, basically, right now?
It does appear so. Certainly from what the scientists are looking at, the receptor binding protein still appears to be the same. And so while there are mutations on some of the spike proteins, it does appear that the antibodies produced by the vaccine would still have some significant impact on the virus. Remember that even if we get a slight reduction in the impact of the vaccine on the virus, it still will have a dramatic impact on the transmission of the virus, and therefore the number of cases that we have, and therefore the number of severe cases that we have. So even if there is a small reduction in efficacy, it will still be a significant impact to have the vaccine available.
I want to be so careful because there's so much misinformation around a vaccine, but are there any groups that should be worried perhaps or think twice before taking a vaccine? One of the questions is around pregnant women, for example.
And that's a really good question. So in general, pregnant and nursing patients are excluded from the safety, the round of trials of vaccines in the first round in terms of safety. And so we generally have relatively poor evidence around the safety of vaccination. However, what we do know about the COVID vaccination in pregnancy at the moment is that individuals who were recruited when they were not pregnant but became pregnant during the trial had no complications from the vaccine. We know that in the laboratory that pregnant vaccinated rats did not have any adverse effects. We know that the type of vaccines that we're looking at, which do not include any live or dead parts of the vaccine, which other vaccines have. So in the case of COVID vaccines, they're either mRNA, which essentially is like a little recipe for creating the antibodies, and so it's just simply a set of instructions that gives the cell the instructions to develop the antibody, and so that set of instructions does not cross the placenta. It degrades too quickly, and the other vaccines are proteins that encourage the body to produce antibodies against the spike proteins which sit on the virus. So we are reasonably, certainly in the scientific community, we are reasonably happy that pregnant individuals may well be should actually be vaccinated. Yeah. We know that pregnant individuals are in fact at higher risk for COVID complications. So in fact, we should probably be vaccinating them because they are at higher risk of COVID, of severe COVID disease.
Yeah. All right. So a vulnerable group, actually target them, you say. Look, I think we should go with the science here. Like many, I'm so welcoming of a vaccine. Hopefully we get it sooner rather than later. But what would you say to people who say, how do we know about the long-term effects? I mean, if these vaccines have just gone through clinical trials?
So I think the important thing around the vaccines is that this is technology that's been in use for decades and has been transferred to another virus. Remember that coronaviruses we've also been studying for some time in terms of MERS and SARS. Those are also coronaviruses. This is just a new variant of that. So this isn't a very that's not new technology. It's pre-existing technology that we've now adapted. Secondly, we've had the entire world working together, putting money in. So that the usual reason that there's delays in vaccine trials is partly because it needs to be financially viable. And because this is a pandemic, these are going to be financially viable. And so there's been no problem putting money into the investment and into the investing into the production or the development of vaccines. So there's really no problem. There's been as vigorous attention to the science and in the trials of these COVID vaccines as there have been to any other vaccines historically. So I think people really need to understand that these are really as safe as can possibly be. And we've really got the most up-to-date type of technology in the vaccine production. I think the other thing that we need to understand is that herd immunity. So vaccines produce herd immunity, or what we call population immunity. And what that means is that the proportion of people within the population if we can get it high enough, then there is insufficient susceptible population for the virus to infect other people. And so we're protected not only by the people who are vaccinated, but we also end up protecting those who are not able to be vaccinated because they might be immunocompromised. So it's really important that we do that, because the only other way of getting herd immunity is for people to get infected. But the risks of that are just that we've got a massive population who gets sick, who are unable to do their work and continue with daily life. They may end up with significantly long-term symptoms of long-haul COVID, and And of course, there's a massive strain on our healthcare system, and particularly for those who get severe COVID and may in fact die. Yeah. So, getting herd immunity through vaccines is a much better option. We prevent deaths, we prevent severe disease, and it just is, and it's also much quicker. We get herd immunity much quicker through vaccination.
Yeah, so you're summarising what some people would say. It's a game changer, and hopefully we can announce more good news on vaccines in coming weeks. Thank you very much, Public Health Medicine Specialist at UCT, Dr. Kerrin Begg. We take a short break. I'll be back with more on The Full View shortly.